Hello, everyone. Bonjour à tous. Welcome and thank you for participating in today's technical briefing, which will provide an update on the COVID-19 vaccine rollout in Canada. Bienvenue au briefing technique afin de donner une mise à jour sur la distribution des vaccins contre la COVID-19 au Canada. Today, we will hear remarks from Dr. Howard Njoo and Brigadier-General Krista Brodie from the Public Health Agency of Canada. They will be accompanied by Joël Paquette from Public Services and Procurement Canada to answer questions. Aujourd'hui, nous entendrons des allocutions de Dr. Howard Njoo et du Brigadier-Général Krista Brodie de l'Agence de la santé publique du Canada. Ils seront accompagnés par Joël Paquette de Services publics et Approvisionnement Canada pour la période de questions. Following the remarks, we will open the teleconference line for questions from the media. Suite à la présentation, nous répondrons à vos questions. If you wish to ask a question, please press star 1 on your phone. Si vous désirez poser une question, veuillez appuyer sur étoile 1. Procédons à la séance d'information technique. Let's begin today's technical briefing. Over to you, Dr. Njoo.
Thank you, merci. Hello, everyone, and thank you for joining us at today's technical briefing on Canada's COVID-19 vaccine rollout. I'm here with Brigadier General Krista Brodie, Vice President of Operations and Logistics at the Public Health Agency of Canada. To assist us in answering your questions, we have with us Joël Paquette from Public Services and Procurement Canada. This week, once again, we're seeing impressive numbers in vaccine coverage. As of today, over 22 million doses have been administered, and as of May 22nd, more than 57% of the population in Canada aged 12 and older has rolled up their sleeves. You'll notice I said 12 and older. This figure now includes the new eligible cohort of those aged 12 to 17. We are progressing towards the first milestone we outlined in our roadmap a couple of weeks ago. That is, 75% of those eligible for vaccines have 1 dose and 20% have 2 doses or are fully vaccinated. By continuing this momentum, we can look forward to small outdoor gatherings with family and friends this summer. In fact, we've already begun to see some provinces and territories with their public health authorities implementing plans to lift certain restrictions in their regions. As of May 21st, there have been 5,989 reports of adverse events following immunization. These include any medical event that occurs following immunization but isn't necessarily related to the vaccine. 1,126 of these reports, about 1 in 18,000 doses administered, were considered serious, such as a severe allergic reaction. As of May 24th, there have been 41 reports of blood clots with low levels of blood platelets following immunization in Canada, with the AstraZeneca or Provincial vaccines reported to the federal level. Of those, 27 have tested positive for PF4 antibodies, meeting the definition of vaccine-induced immune thrombotic thrombocytopenia, or VIT. Laboratory testing on the remaining 14 individuals is ongoing. Among confirmed VIT cases, sadly, 5 deaths have been reported. We offer our most sincere condolences to the families and friends of those who have passed away. We continue to take these reports of side effects to vaccines, however rare, very seriously, and we consider these carefully when looking at the vaccine portfolio in Canada. It's important to remember that the vast majority of COVID-19 vaccine side effects are minor and resolve within a few days. It's quite possible to have a sore arm, fatigue, aches, or even a mild fever after your vaccination. Don't hesitate to ask a healthcare provider if you have any concerns about symptoms after receiving your vaccine. This week is both Paramedic Services Week and Indigenous Awareness Week. I'd like to first express my gratitude on behalf of all Canadians for paramedics' sacrifices and service on the front lines, particularly over this past year in the face of COVID-19. And secondly, I want to acknowledge the outstanding leadership that Indigenous communities and leaders have continuously shown throughout this pandemic, and their work encouraging individuals and communities to roll up their sleeves and achieve high levels of vaccination. One example is the Protect Our People MB campaign in Manitoba, which aims to bolster vaccine confidence and uptake among young First Nations people in that province. This campaign uses creative social media messaging and reputable influencers to dispel misinformation and encourage broader awareness of the facts about COVID-19 and the vaccines. Grassroots efforts like these build trust and help protect Indigenous peoples and cultures and are essential to Canada's vaccination efforts. Let's all take inspiration from these leaders and reflect on what we can do in our own communities to make sure every eligible person gets a shot at being protected from COVID-19. Thank you. Bonjour tout le monde. Merci de vous joindre à nous aujourd'hui pour cette séance d'information technique sur le déploiement des vaccins contre la COVID-19 au Canada. Je suis ici avec Madame la Brigadier-General Krista Brodie, vice-présidente de la logistique et des opérations à l'Agence de la santé publique du Canada. Pour nous aider à répondre à vos questions, nous sommes accompagnés de Joël Paquette des Services publics et Approvisionnement Canada. Cette semaine, nous observons une fois de plus des chiffres de couverture vaccinale impressionnants. En date d'aujourd'hui, plus de 22 millions de doses ont été administrées et en date de 22 mai, plus de 57 % de la population canadienne de 12 ans et plus a relevé sa manche. Oui, j'ai bien dit 12 ans et plus, car ce nombre inclut maintenant la nouvelle cohorte admissible de 12 à 17 ans. Nous nous approchons du premier jalon fixé il y a quelques semaines dans notre feuille de route, soit que 75 % des personnes admissibles à la vaccination aient reçu une première dose et que 20 % de celles-ci aient reçu 2 doses ou soient pleinement vaccinées. En poursuivant sur cette lancée, nous pouvons espérer tenir de petits rassemblements extérieurs en famille et entre amis cet été. En fait, nous voyons que les autorités de santé publique de quelques administrations provinciales et territoriales ont déjà mis en œuvre des plans d'assouplissement de certaines restrictions dans leur région. En date de 21 mai, 5 989 cas d'effets secondaires suivant l'immunisation ont été signalés. Ces cas incluent tous les incidents médicaux se produisant après la vaccination, qu'ils soient ou non liés au vaccin. Parmi ces signalements, 1126, soit environ un quart sur 18 000 doses administrées, sont considérées comme graves, comme les réactions allergiques graves, par exemple. En date de 24 mai, 41 cas de caillots associés à une faible taux de plaquettes sanguines ont été signalés à l'échelon fédéral après l'administration d'un vaccin d'AstraZeneca ou d'un vaccin Covishield au Canada. De nombreux 27 ont été analysés pour la détection d'anticorps dirigés contre le facteur plaquette 4, correspondant à la définition de cas de thrombocytopénie thrombotique immunitaire induite par le vaccin, aussi appelé TIV. Des analyses en laboratoire sont en cours pour les 14 autres cas. Malheureusement, parmi les cas confirmés de TIV, 5 décès ont été signalés. Nous offrons nos plus sincères condoléances aux familles et aux proches touchés par ces décès. Nous continuons de prendre très au sérieux ces signalements d'effets secondaires liés au vaccin, aussi rares soient-ils, et nous nous penchons sur ci tandis que nous envisageons le portfolio sur la vaccination au Canada. Il importe de ne pas oublier que la grande majorité des effets secondaires des vaccins contre la COVID-19 sont bénins et disparaissent en quelques jours. C'est très possible d'avoir le bras endolori, de la fatigue, des courbatures ou même une faible fièvre après la vaccination. Si vous avez des préoccupations relatives à vos symptômes après vous être fait vacciner, n'hésitez pas à en parler avec un professionnel de la santé. Nous soulignons cette semaine à la fois la semaine des services paramédicaux et la semaine de sensibilisation aux cultures autochtones. Je tiens d'abord à exprimer toute ma gratitude au nom de l'ensemble de la population canadienne aux paramédicaux et aux paramédicales pour leur sacrifice et leur travail en première ligne, en particulier en cours de la dernière année contre la pandémie de COVID-19. Je tiens aussi à reconnaître le remarquable leadership des communautés et des dirigeants autochtones tout au long de la pandémie, de même que le travail pour encourager les personnes et les communautés à relever leurs manches et atteindre des forts taux de vaccination. Je cite à titre d'exemple la campagne Protégeons les nôtres MB au Manitoba qui vise à renforcer la confiance à l'égard des vaccins et à augmenter les taux de vaccination chez les jeunes autochtones dans la province. La campagne utilise des messages dans les médias sociaux et des influenceurs réputé pour contrer les mésinformations et favoriser une connaissance plus vaste des faits concernant la COVID-19 et les vaccins. Les efforts de la base comme ceux-ci renforcent la confiance, contribuent à la protection des peuples ainsi que des cultures autochtones et sont essentiels aux efforts de vaccination au Canada. Laissons-nous tous et toutes inspirés par ces dirigeants et réfléchir à ce que nous pouvons faire dans nos propres collectivités pour garantir que chaque personne admissible puisse se faire vacciner et être ainsi protégée contre la COVID-19. Merci et j'invite maintenant Madame la Brigadier-General Krista Brodie à prendre la parole.
Good afternoon. To date, we have shipped more than 26 million doses of COVID-19 vaccines across Canada, more than 5.1 million last week alone. This week, the team at the National Operations Centre coordinated the distribution of the remaining 600,000 doses of Pfizer-BioNTech from this week's allocation. Moderna shipped us an additional 100,000 doses with last week's shipment, doses that are currently being distributed, bringing this week's total to more than 700,000 doses. Looking ahead, we expect weekly shipments of 2.4 million Pfizer-BioNTech doses per week in June and close to 2.3 million doses weekly in July. Moderna has confirmed delivery schedules for the next shipment, which include 500,000 doses expected to arrive next week in two parts. The initial shipment is expected to arrive in the country early next week, while the second shipment is expected to arrive over the weekend, next weekend, with distribution occurring the following week. The next confirmed shipment for 1.5 million doses is set to arrive in country mid-June. We expect Moderna to continue to ramp up its deliveries in the second part of June, with millions of additional doses to be delivered. In addition to Pfizer-BioNTech shipments, Canada is set to receive close to 3 million doses next week. We are continuing to work with stakeholders to ensure sufficient supply of AstraZeneca for second doses. We continue regular discussions with the provinces and territories, with a particular focus in the coming weeks on ensuring that capacity to administer vaccines is aligned with vaccine availability. With the confirmed shipments of Pfizer-BioNTech and positive indicators from Moderna this week, we are well on our way to distributing more than 40 million doses by the end of the second quarter. Across the vaccine rollout enterprise, at all levels and in all departments and jurisdictions, people are working relentlessly to ensure that Canadians can be vaccinated safely and as soon as possible. Thank you. Bon après-midi. À ce jour, nous avons expédié plus de 26 millions de doses de vaccins contre le COVID-19 à travers le Canada. Plus de 5,1 millions rien que la semaine dernière. Cette semaine, l'équipe du Centre national des opérations a coordonné la distribution de 600 000 doses restantes de Pfizer-BioNTech de cette semaine. Moderna nous a expédié 100 000 doses supplémentaires avec la livraison de la semaine dernière. Ces doses sont actuellement en cours de distribution, ce qui porte le total de cette semaine à plus de 700 000 doses. Pour la suite des choses, nous prévoyons des livraisons hebdomadaires de 2,4 millions de doses Pfizer-BioNTech en juin et de près de 2,3 millions de doses par semaine en juillet. Moderna a confirmé la livraison des prochains envois qui incluent 500 000 doses qui arriveront au cours de la semaine prochaine en 2 envois. L'expédition initiale devrait arriver au Canada au cours de la première partie de la semaine prochaine. Le deuxième envoi devrait arriver au cours de la fin de semaine et la distribution aura lieu la semaine suivante. Le prochain envoi conformé de 1,4 million de doses devrait arriver dans le pays à la mi-juin. Nous nous attendons à ce que Moderna continue d'augmenter ses livraisons au cours de la deuxième moitié du mois de juin, avec des millions de doses supplémentaires à livrer. En plus des livraisons de Pfizer-BioNTech, le Canada devrait recevoir près de 3 millions de doses la semaine prochaine. Nous continuons à travailler avec les parties prenantes pour assurer un approvisionnement suffisant en AstraZeneca pour les deuxièmes doses. Nous continuons d'avoir des discussions régulières avec les provinces et les territoires, avec un accent particulier dans les semaines à venir sur l'assurance que la capacité d'administrer les vaccins est alignée avec la disponibilité des vaccins. Avec les livraisons confirmées de Pfizer-BioNTech et les indicateurs positifs de Moderna cette semaine, nous sommes sur la bonne voie pour distribuer plus de 40 millions de doses d'ici la fin du deuxième trimestre. Dans toute l'entreprise de déploiement de vaccins, à tous les niveaux et dans tous les ministères et juridictions, les gens travaillent sans relâche pour s'assurer que les Canadiens et les Canadiennes puissent être vaccinés en toute sécurité et le plus rapidement possible. Merci.
We will now open the phone line to questions. We ask that you limit yourself to one question and only one follow-up. We will be taking your questions in both official languages. Nous vous demandons de vous limiter à une question et seulement une question suivie. Vous pouvez poser vos questions dans l'une ou l'autre des langues officielles. We'll start with the first question. Première question, opérateur.
Thank you. Merci. Our first question, notre première question, is from Mia Robson with the Canadian Press. Please go ahead. À vous la parole.
Yes. Hi. Good afternoon. I'm wondering if you could, either Dr. Njoo or Brigadier-General Brodie, if you could talk about the idea of second doses. There's more calls to move faster to second doses. You said that you want 20% of people to have that second dose before we can look at opening up. But at the current rate, we're months away from getting there. I'm just wondering if you think it's time to start moving towards second doses, also in light of the new study out of the UK on how well first doses are working against variants.
It's Dr. Njoo. Maybe I can start from the public health perspective, and then Brigadier General Brodie can certainly speak to the logistics. From what we're seeing, certainly talking to quote my counterparts in the provinces and territories, it's already starting to happen in terms of offering second doses to, in many ways, starting again with the priority groups that were offered the first doses. So we're seeing it, I think, with appointments being moved up in terms of getting that second dose. So it's happening. Obviously, the plans are being modified in the provinces and territories based on the availability of vaccine, and certainly we're seeing that the more and more people are getting that second dose. So I think we have moved steadily. I think we're somewhere in the neighborhood of sort of 5% or so of the population overall having received sort of the two doses. And that number, I think, will be going up. And certainly for the first dose, we're well over 50%. It's, I think, even 60% or so if you're looking at the population 18 and over. It's about 62%, I think, the last figure I've seen. So everything's trending in the right direction, and we get it. And in the provinces and territories, and NASA has also said that you should be trying to vaccinate to now. Sort of obviously, 16 weeks was the outer limit, but certainly if you can do it sooner, that's the way to go, and that's what the provinces and territories are now undertaking. Thank you.
Brigadier General Brodie here. From a supply perspective, certainly the numbers that we're seeing in terms of confirmed deliveries through the end of June and into July would indicate that there are sufficient doses available for first doses, as well as concurrency in second doses, and that capacity will just continue to grow over the summer. Thank you.
Thank you. But Dr. Njoo, just going back to the concerns raised from that study that came from Public Health England this week that suggests first doses aren't as effective against the variants, the B117, but more particularly the B1167 variant. If we have concerns about that, and I've just seen a lot more calls from infectious disease specialists and doctors saying that older Canadian seniors also are sort of ending up in hospital after just one dose because they're not as protected, and maybe we're not moving as fast. I mean, yes, it's starting, but we're still very far behind on second doses. Is it time to really start to speed that up?
Yes, it's Dr. Njoo. Yes, I think we are speeding up. I think if you look at obviously data from around the world, there's different studies you can look at. I think overall here in Canada, we're seeing a very positive impact. We're looking at the rates of illness, infection, hospitalization, deaths among the older age cohorts that obviously were among the first to receive that first dose, and then also many of them getting their second dose, especially in nursing homes. And we're seeing that the morbidity and mortality have dropped. So there is obviously a positive impact. You're right. I think that overall, when you speak about the variants, the vaccines are effective. Certainly there might be a bit of a drop off. There's no vaccine that's 100% effective, but I think it just speaks to the point that we need to vaccinate as many Canadians as quickly as possible. And also the fact that with the variants, so we can't let go of the public health measures. I know it sounds like a broken record, but it's sort of a two-pronged approach, right? It's vaccinate as quickly as possible, as many Canadians, but at the same time, you can't let go of the public health measures. And as we're seeing with various provincial, territorial sort of reopening plans, they certainly, I think, recognize you need to take into account what's happening on the ground in terms of community transmission, and obviously as lagging indicators of what's happening with their healthcare system. Because I think really what we're all trying to avoid is a fourth wave and certainly overloading our healthcare system yet again. So I think it just speaks to the importance of both maintaining the public health measures, both at a community level and individually, and then getting as many Canadians vaccinated as quickly as possible. Thank you.
Thank you, Dr. Njoo. Prochaine question. Next question.
Thank you. Merci. Our next question. Notre prochaine question is from Christian Noël avec Radio-Canada. Please go ahead. À vous la parole.
Bonjour, mesdames, messieurs. Écoutez, j'ai une question assez claire, je pense, et j'aimerais avoir une réponse claire, si possible. Avec Moderna, on semble avoir des problèmes d'approvisionnement. On nous dit, vous en faites pas, on va avoir assez de doses pour la première dose. Je le comprends, mais j'essaie de comprendre quel est le problème présentement avec Moderna.
Merci pour la question. Il n'y a pas un problème tel quel avec Moderna. Comme on avait mentionné au mois d'avril, il y aurait des turbulences avec avec les livraisons parce qu'ils travaillaient sur augmentation de la production de leurs vaccins dans leur manufacture. Donc, il n'y a pas un problème comme tel, c'est seulement certaines difficultés qu'ils ont eu à augmenter leur production pour être capable de livrer plus de doses dans les délais qu'on s'attendait. Merci.
Merci. J'aimerais aussi savoir le nombre de doses qui pourraient arriver à leur date de péremption. Est-ce qu'on a une idée de à quoi ça ressemble, où elles se trouvent et comment est-ce qu'on a un plan pour essayer de maximiser ça entre les provinces pour s'assurer de ne pas perdre de doses qui s'approchent de leur date de péremption? Merci.
Je crois que vous parlez des doses d'AstraZeneca.
C'est bien ça, merci.
Donc, je vais demander à Général Brodie de répondre à la question.
Donc, on est en train de travailler très proche avec les provinces et pour s'assurer qu'ils pourraient utiliser toutes les doses dont il a maintenant pour vacciner les plus canadiennes que possible. Et si il y a des inquiétudes avec les dates d'expiration, Peut-être on peut faciliter la coordination entre les juridictions pour partager les doses, pour s'assurer qu'ils pourraient les utiliser en accordance avec leur plan de vaccination pour maximiser les deuxièmes doses avant la date d'expiration. Donc, on est en train de communiquer avec toutes les juridictions pour maximiser l'usage des AstraZeneca. Merci.
Merci.
Opérateur, prochaine question. Next question.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Marika Walsh with the Globe and Mail. Please go ahead. À vous la parole.
Good afternoon. I think my question is for Madame Paquette. I'm wondering if you can explain to us, or if you can tell us what Moderna's explanation is for not being able to give that full delivery schedule that the government asked for last week. Last week, we were told that the government was pushing for a precise delivery schedule for June and July. And in response, Moderna has given a schedule for the next 3 weeks that does not account for the full target for Q2.
Thank you for the question. We're actually continuing to work with Moderna to firm up its delivery schedule. It was announced today that they will have 2 shipments next week for a total of 500,000 doses, as well as a shipment the week of June 14th for 1.5 million doses. And we expect to be in a position to provide further detail in the coming weeks on additional doses in June. So, we're providing the information we have as it comes available. Thank you.
Okay, my question was why they're not able to give the full schedule. So I don't know if you can explain that. But my second question is for Brigadier-General Brodie, I believe, or if somebody else wants to weigh in, maybe Dr. Njoo. You're talking about how Canada is hitting these targets on percentage coverage. Can you tell us what your projections show for when specifically Canada will hit that 75% first dose target and 20% second dose target?
So on the first question, what we would like to provide you is firm information on the delivery schedule of Moderna. And that is what we are giving to you when we have that information available to us. And that is how we will continue to provide this information. Thank you.
It's Dr. Njoo. I could probably start in terms of the second question. So certainly we've indicated, quote, at a sort of a pan-Canadian or national level, these, I would say, in some ways, aspirational targets of a 75% of Canadians being offered and hopefully accepting that first dose, and then 20% having received 2 doses as a point at which obviously you can seriously start looking at the sort of lifting certain public health measures. But obviously it depends on the local situation, as we've indicated before, what the level of community transmission, and more importantly, what the strain might be on the sort of the healthcare system, both at a very local and regional level, and then of course at a provincial level. Each of the provinces and territories are obviously really pushing forward, and they're at, I would say, similar stages in terms of their vaccine rollout. But it's hard to say for the country as a whole because, one jurisdiction may hit a certain level of vaccine coverage before another. So I don't think it's easy to sort of give an overall date for the country as a whole. I think you're probably best placed to ask or look at each of the individual provinces as they move ahead with their individual vaccination programs. Thank you.
Thank you. Merci. Our next question, notre prochaine question is from Catherine Lévesque with La Presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à vous tous. Ma première question, je crois, serait pour Madame Paquette. Si je me trompe pas, on devait avoir une livraison là, de Janssen & Janssen au mois de juin. Je me demandais qu'est-ce qui arrive avec cette livraison-là. Est-ce qu'elle a été cancellée vu la situation actuelle ou est-ce qu'elle est toujours prévue?
Merci pour la question. Comme vous savez, nous avons reçu 310 000 doses de Johnson & Johnson plus tôt Et ces doses sont toujours avec nous en attendant l'approbation de Santé Canada. Et présentement, les livraisons supplémentaires de Johnson & Johnson seront confirmées une fois que nous aurons plus de détails sur la confirmation de Santé Canada sur même les doses de 310 000 présentement au Canada. Merci.
OK. Oui. Donc, est-ce que donc, j'en comprends que les livraisons sont suspendues. Si vous pouviez juste me confirmer ça. Puis j'ai une autre question, en fait, pour la Brigadière-Générale Brodie. Bon, je comprends qu'il y a toujours beaucoup d'incertitudes autour de Moderna, mais je pense que ce qu'on aimerait savoir, c'est est-ce que vous pouvez confirmer à ce moment-ci qu'on n'aura pas 48 à 50 millions de doses de vaccins d'ici la fin du mois de juin? Est-ce que ce serait là, exact d'affirmer ça?
Merci pour la question. Les doses de Johnson & Johnson ne sont pas suspendues. Nous attendons la confirmation de Santé Canada et aussi la confirmation de Johnson & Johnson pour la livraison des doses qui font partie de notre entente avec eux, qui sont les 10 millions de doses, le 10 millions de doses. Je vais passer la parole à Madame Général Brodie.
Donc, on a les livraisons conformées pour 40 millions de doses vers la fin de mois de juin. Et on va ajouter de ce numéro avec chaque confirmation qu'on reçoit avec les nouvelles des prochaines livraisons. Donc maintenant, avec les livraisons conformées pour Moderna et pour Pfizer, on va atteindre 40 millions de doses vers la fin de la mois de juin. Merci.
Merci beaucoup. Prochaine question. Next question, please.
Thank you. Merci. Our next question. Notre prochaine question is from Ryan Tumulty with the National Post. Please go ahead. À vous la parole.
Yeah, hi. I wanted to ask about the Moderna shipments. Even with the doses announced today, the company is still just over 6 million doses short of where it is supposed to be by the end of June, by the end of the second quarter. I'm wondering if you have confidence in their ability to make up that 6.6 million dose gap between mid-June and the end of June.
Thank you for the question. I can confirm that Moderna is committed in providing doses to Canada as soon as possible, and we continue to work with them to firm up their delivery schedule for June. Thank you.
Yeah, I guess just as a follow-up then, I'm wondering, given Moderna's so far inability to provide you, to stick to that schedule, and given that we're giving out so many Pfizer doses as first doses, are we considering exercising any of our options for additional Pfizer doses so that they are available for future second doses if so many of our first doses are going to be Pfizer?
Thank you for the question. As mentioned, we're continuing to work with Moderna to firm up their delivery schedule. We are confident that they will meet delivery schedules with Canada, and so I can't confirm whether or not other discussions are happening or speak to other discussions that may be happening with other suppliers. At the moment, we're looking at over 2.4 million doses per week from Pfizer, and we're looking at between now and mid-June, 2 million doses from Moderna, and we're expecting additional doses from Moderna before the end of June. And as mentioned, once we have that firm commitment, we will be providing that information. Thank you.
Merci beaucoup. Prochaine question. Next
I can
question.
offer.
Thank you. Merci. Our next question, notre prochaine question is from Tom McCharles with the Toronto Star. Please go ahead. À vous la parole.
Thanks. Just before I ask my question, I think General Brodie wanted to weigh in on that last part. So before I ask my question, General Brodie, if you wanted to just add your bit there.
Thank you. I can just offer that from a logistics and delivery perspective. We're working very closely with the provinces and the territories to ensure that we have the capacity in the system to be able to ramp up to meet the increased demands or the increased shipments whenever they arise in the system over the coming months. So aligning that administration capacity for vaccines and vaccination programs with the supply is a real concerted effort that we are continually discussing and working with the provinces and territories on to ensure that we have the capacity to move as many vaccines as become available as quickly as possible into the arms of Canadians. Thank you.
Thanks. My question is for you, I guess, General Brodie. According to the federal numbers, you've distributed, you say, I guess, 26 million across the country. Some 10 million doses have been delivered to Ontario, and only 8.5 million administered. Do you have a clear idea what's going on with the other 1.5? Is it just a matter of a slow rollout? Is that because most of those doses are AstraZeneca being withheld? It's just not clear to me what's going on there. Can you give me your thoughts on what's going on there?
Certainly, I won't speak on behalf of the provinces with respect to their vaccine distribution programs, but I can indicate that we work very closely on a day-to-day basis, coordinating the vaccine supply and working with the provinces to ensure that they have the supply they need in order to support their programs. Thank you.
The question about when Canada hits that target of 75 first dose, 20% having second dose, I want to ask it not in terms of when will people have those doses in arms, but I'm asking, what is the date at which you are now projecting that there will be enough supply in Canada for that target to be met? In other words, when will you, Ottawa, bring in enough, have brought in enough vaccine to have met the target, given the ages that are approved for vaccination, to hit the 75-25 target, or 75-20 target?
We have confirmed shipments
I'm sorry, I just want to be very clear here. The Prime Minister has already said that is the number that he's using when it comes to looking at the border reopening. So is there a date by which at least that number in terms of supply can be hit?
So we have confirmed deliveries for upwards of 40 million doses by the end of June and upwards of 50 million doses for the end of July. Now it's up to the provincial and territorial jurisdictions to roll out their vaccination campaigns in accordance with their best needs. But certainly from a supply perspective, we have confirmed forecasts for 40 million doses in the country by the end of June and 50 million doses in the country by the end of July, working on today's numbers. Thank you.
Thank you. Merci. Our next question, notre prochaine question, is from Peter Cohen with CBC Newfoundland. Please go ahead. À vous la parole.
Newfoundland and Labrador has taken 1,400 doses of AstraZeneca that are set to expire at the end of the month and has sent them back to the federal government. What's going to happen with those doses?
So we're working across jurisdictions right now to ensure that as many of those doses as absolutely possible can be used to vaccinate Canadians, particularly in those jurisdictions that are moving forward with their second dose AstraZeneca administration plans. And should we arrive at expiry dates, then remaining doses will be will be disposed of in accordance with public health best practices, and we'll report those centrally and monitor that closely to ensure that we're maximizing the number of doses that are used to immunize Canadians.
And aside from Newfoundland and Labrador, how many other provinces have said that they are going to repatriate doses, and how many doses are you expecting to have returned?
So we don't report on specific provinces and territories in that regard, and because there is still time before those first doses expire, there are active efforts to ensure that as many of them get used as possible. So once we roll past expiry dates and are in a position to report, then by all means we'll do so in the spirit of transparency. But at this time, we're still rolling towards the first of the AstraZeneca expiry dates of concern. Thank you.
Thank you.
Merci. Prochaine question.
Thank you. Merci. Our next question, notre prochaine question is from Brian Mullen with Global News. Please go ahead. À vous la parole.
Thank you. Following up on Mia's question regarding interval for second doses, NACI has approved a 16-week interval. Provinces are each making their different decisions. By how much do you think the provinces should be shortening the gap? With the increase in vaccine deliveries, do you think we could get it down to the manufacturer recommended 3 to 4 week gap?
It's Dr. Njoo. Maybe I can answer that question in part. And it's interesting that the way you've put it, obviously, if you look at the original product monograph for let's say the AstraZeneca vaccine, it was 4 weeks. Then obviously you look at the UK and they increased the dose interval, obviously with some of the same kind of strategy approach as Canada with an extended dose interval to try and vaccinate as many people as quickly as possible to 12 weeks. And in Canada, as you know, NACI has said that the dose interval could be extended up to 16 weeks, but certainly could be then shortened depending on getting more vaccine into the country. The UK, as you know, has now also done studies to look at what the effect is of increasing that dose interval, and they've actually found that the actual immune response is greater among those that have had a longer dose interval, up to 12 weeks compared to the original manufacturer, sort of a product monograph saying 4 week interval. So I think someone maybe ironically now people are saying, "Whoa, okay." So now that the real world experience shows that an increased dose interval is actually better in terms of an immune response. How much shorter could or should we make it, as you say, to get closer to the product monograph? I think in Canada, the province and territories are obviously looking at the same sort of evidence that we're seeing from around the world, from other countries' experience. I think Ontario, so on, other provinces are looking at maybe 10 weeks. I think probably the minimum is that maybe down to 8 weeks. So based on the science and what we know about the dose interval, that appears to be where the provinces are now moving towards in terms of, you say, decreasing the dose interval. At this point, I don't anticipate that provinces may go lower, but obviously as the science continues to evolve and more data becomes available, that could certainly be modified as well. Thanks.
Thank you. Merci. Our next question.
Sorry, I do have a follow-up. Dr. Njoo, on a separate matter for my colleagues in Alberta, could we get your reaction to the Alberta reopening plan? Stage 3 is linked to first shot of vaccination only. Is that a concern? And do you have any concerns about provinces reopening too quickly?
Thank you for the question. I think, certainly among the public health community, speaking with Dr. Dina Hinshaw and our counterparts across the country, I think we're all on the same page. We're certainly recognizing that we need to be prudent, and if there are sort of reopening plans, they need to be done in a very, I think, thoughtful, sort of a stepwise fashion that is linked not just to vaccination rates and vaccine coverage, but also to what's happening, as we always have referred to in terms of the indicators with respect to community transmission and certainly by extension of what's happening with the healthcare system. We know that community transmission in some ways is linked with the lagging indicators. And I know in Alberta, they're very seized with the issue in terms of not overloading the healthcare system, which obviously I think is a priority as well in the other provinces, territories across the country. So I would say that looking at the Alberta plan, it talks about vaccination rates, but I think we need to also appreciate that underneath that, you need to also very carefully follow the epidemiology, very carefully follow what's happening in terms of obviously hospitalizations and sort of severe outcomes as you're tracking vaccine coverage. So it's not just about the vaccine coverage alone, as we've said multiple occasions, but also looking at what's happening in the community. And even then, I would say that within any given province, it's not for the province as a whole, but really at a more granular local level, because let's say in an urban area, be it a Calgary, Edmonton, it might be a different reality compared to maybe a more rural setting. So I think that's what we certainly anticipate our provincial colleagues are doing in the province of Alberta and also across the country in other provinces and territories. Thank you.
Thank you. Prochaine question.
Thank you. Merci. Our next question, notre prochaine question is from Tom Perry with CBC News. Please go ahead. À vous la parole.
Hello. Thanks for taking my question. My question is for Dr. Njoo. Dr. Njoo, I'd like to ask you about the Olympics. Japan's doctors union says it's worried that the Olympics could spread current variants of COVID-19. It could also even create a new variant, bringing all these athletes and trainers from all over the world together in Japan. I'm wondering what you think about those concerns and whether you still think it makes sense for Canada to send athletes to the Tokyo Games.
Thank you for the question. I think I'll just speak from a public health perspective. Certainly, what you're mentioning in terms of the physician scientists in Japan, I think I understand, respect that, because obviously, anytime you get groups of people congregating together, even let's say the athletes in a bubble, there is obviously the chance of interaction and potentially and transmission and spreading of the virus. Having said that, certainly. My understanding is that countries that are sending delegations are making their best efforts to vaccinate the athletes, and certainly if there's a high level of vaccine coverage, and it's obviously athletes coming in and out under tightly controlled conditions, just maybe coming in for their event and then leaving, and so on and so forth, that certainly that the public health risk can be mitigated. It's never zero, but certainly it can be mitigated. So that's sort of the technical public health response. In terms of the question of whether, could or should the Olympics be held at all, I think that's obviously a question for others beyond myself, because that obviously involves other considerations than purely the public health aspects. I would say that here in Canada, I think we're quite excited. We just had a discussion with the Canadian Olympic Committee as well as the Paralympic Committee, and certainly Canada's plan at the present time is to send our athletes over, and with the expansion of obviously the eligibility for Canadians down to the age of 12, as well as the supply that we have in the country, plus the fact that I understand Pfizer has given actually an offer of vaccine for the athletes, that I think it's a great opportunity to offer the vaccine to these individuals, because they're like any other Canadian, obviously, based on age alone. And I think they would be great role models as well if they were to obviously go forward, get vaccinated, fully vaccinated before they go, to show other young Canadians that, hey, they realize and recognize the importance of getting vaccinated. So that's all I'll say in terms of the public health aspects. To the other point about the Olympics and whether they could or should be held, obviously there's lots of other factors beyond what I could comment on. Thank you.
My other question then, I guess it has to do with, people traveling, whether for the Olympics or other reasons. As we get more Canadians receiving their second dose of vaccine, whatever vaccine they get, if Canadian travelers are fully vaccinated, are they still going to have to quarantine when they come back into this country?
At the present time, that's certainly the stance with respect to the requirements for any incoming traveler, regardless of vaccination status. I think I've mentioned before some of the technical aspects, but I would say that it's a live issue, and we recognize that in terms of travel documentation, which obviously is a federal responsibility, be passports, or even the fact that for many countries you need a certain certificate, let's say for yellow fever vaccine, in order to go to certain countries. That principle has been well established. We recognize, and we certainly, I think, at different levels, are working with other governments around the world to standardize and get a sort of a consistent approach, even in terms of some of the technological aspects of working with, for example, civil aviation authorities and so on, so that Canadians would be able to, let's say, if they were to travel at some point, have the same sort of ability to show proof of vaccination that citizens of other countries would have. So that's something that's a work in progress. And as I mentioned before, here in Canada, it's something we're working on closely, because the federal government is responsible for, let's say, the issue of travel documents and what Canadians require in terms of going overseas and coming back. But certainly vaccination per se is obviously the responsibility of the provinces and territories. So there's still work to be done in terms of the vaccine databases, protecting privacy, confidentiality of patient records, et cetera, versus what might be required and what Canadians could be using in terms of traveling overseas. But that's obviously for a later day. At the present time, we're still obviously recommending that Canadians should not be traveling outside of Canada for non-essential reasons.
La prochaine question sera la dernière. Next question will be the last.
Thank you. Merci. Our last question, la dernière question, nous vient de Alex Boyd with the Toronto Star. Please go ahead. À vous la parole.
Hi, guys. Thanks for taking questions. Probably a question for Dr. Njoo, but wondering if it's possible to get an update on the Janssen shipment. Now that they've been on hold for about a month, just wondering if you can give us a sense of when there might be a decision on those, and also clarify what exactly the concerns are at the moment, whether it's still the manufacturing facility in the States, or whether it's blood clots, or kind of what the specific issue that is being considered right now.
It's Dr. Njoo. I could start, but certainly would defer my colleagues if they have additional information. Really, I have nothing further to offer, because obviously I'm not in the know. It's the authorities at Health Canada. They're looking closely at the situation. The reason for the shipment being sort of, quote, in quarantine, even though it's in country and sitting in freezers, is a sort of a quality assurance program. As I think we've indicated before, it's because of a certain, I think, sort of I say, how you call it, a product or so, not product, but I can't find the word, something that's used in the vaccine that has come from the facility, the emergent facility in the United States, that obviously has had some quality control issues. And certainly Health Canada continues to work closely with their FDA counterparts, as well as the manufacturer, to look at sort of the issues involved. And they'll make a decision in terms of whether they're satisfied that from a quality assurance point of view, that these particular vaccines and this particular shipment sort of pass sort of their quality assurance protocols before they will release it. But the work's still ongoing, and I have nothing further to offer at this point. So I would pass it on to my colleagues if they have any additional information. Thank you.
No information. Thank you.
Thank you. And
I have no further information.
Oh, sorry. Thank you. Just as a quick follow-up, do we happen to know when those doses expire? Are they the same kind of window as the AstraZeneca doses?
I can speak to that. Those doses are still in their frozen state, so they have a very long shelf life in their frozen state.
Okay, thank you.
C'est ce qui met fin à le breuvage technique d'aujourd'hui. That will be all for today's technical briefing. Merci d'avoir été avec nous. Bonne soirée.